Dr. John Venglarchik is a pediatric and infectious disease physician and professor. The information presented in this video is based upon current available published literature.
Thank you for being here. Let's begin with the very basics. What exactly is a virus? What's the simplest way that you can explain how a virus expresses itself in the human body, specifically a respiratory virus?
Well, we need to talk about all the germs that live on and in human beings. And we're going to start from the large and we're going to get down to the small. And the largest germ, if you will, that lives on us is a mite. And there are mites that live on our eyelashes and they live on our eyebrows, and they eat the dead skin cells, and they live their whole life on our eyelashes and our eyebrows. And that's everyone. That's not just people who live here, people who live there. We all have these on our body. Then there are parasites, and we don't like to talk about parasites because I think, unfortunately, we use the word worm, which a lot of people find disgusting, but that's what they are. There's a parasite called pinworms, which are very, very common in humans. We've all had it at one time or another. And so those are parasites. The next one down are yeast. And we're familiar with yeast because they cause thrush in small children, and they cause vaginal yeast infections in females. And after that are bacteria, and probably the bacteria that we're most commonly familiar with is strep, the bacteria that causes a sore throat. Then after that, we get down to viruses. Now, the difference between viruses and everything I've set up to this point in time is that viruses in and of themselves aren't alive in the sense of the word. A virus has to make itself into a cell, a human cell of one of the things that I just talked about, and they take over the cell's mechanism, and what they do is they make new copies of themselves. The example would be sitting down there and looking at an automobile factory, and it makes Volvos. And if somebody came in and converted it over to turning into making Saabs, that's exactly what a virus does. It comes into your cell and makes more copies of itself at the expenditure of that cell, and ultimately the cell dies, and that's why the symptoms develop. Finally, and I think we're all familiar with something about 20 years ago, mad cow disease was in the news and caused a lot of concern. Mad cow disease is caused by an infectious agent known as a prion. So there we have it. We have mites, or insects, if you will, arachnids, and then we have parasites, we have yeast, we have bacteria, we have viruses and prions.
So what specifically then is COVID-19?
COVID-19 is the disease caused by a virus that's known as SARS coronavirus 2. It's a long term. All these things are named very long, and I'm going to apologize for them, but we'll call it SARS-CoV-2, but it's SARS coronavirus 2. And the reason it's called that is to distinguish from a virus that was present in 2003 and 2004, which some of you may recall, which was SARS. It was a respiratory disease that started in Hong Kong, made it to Toronto, spread around the world, and caused a lot of concern for a lot of people. That's the original SARS coronavirus, or SARS-CoV, and then this is the second one, so SARS-CoV-2. So the disease that SARS-CoV-2 causes is called COVID, and the whole group of viruses are known as coronaviruses. Now, there are at least 4 other human coronaviruses that cause infections in humans. The average child, by the time they're 8 to 9 years of age, have had 40 to 45 upper respiratory infections, colds, if you will. Approximately a third of those infections are due to human coronavirus. So children are very experienced with this particular virus, and as a consequence, have developed some immunity to this virus by the time they're 8 to 9 years of age. Adults get colds, and we all get them at varying rates, but if you've had a cold in the last 5 to 10 years, it's a fairly good probability that one of them was a coronavirus. And that's the so that's the name of the virus, and the disease it causes is called COVID, and it's a respiratory virus. This is a virus that wants to live in our nasopharynx. That's a big word. It's the top of our nose and the back of our throat. It kind of goes from about here down to here, and those are cells that it wants to live in. We talked before, I said that the virus has to live in a human cell. Well, the coronaviruses want to live in the cells in our nasopharynx. So it has to make it there. And once it makes it there, it can take those cells over and make new copies of itself. And then it causes the symptoms that we typically see with coronavirus.
And that was actually leading right to my next question is, what really are the symptoms?
Well, the symptoms in general are fever, coughing, sneezing, respiratory distress, fatigue, and alterations in smell and taste. That's the one that we're all hearing about. But we have to understand when we're talking about children, it's different. And they don't have all those symptoms that adults have. Sitting down there and trying to ask a 3-year-old, do you have a change in the sense of taste, would be impossible and futile. It's not going to happen. Talking to a 5-year-old about changes in the sense of smell, you're probably not going to get that. So we're not going to talk about those symptoms in children because they're really hard to discern. Children, less likely to have fever. There's some studies out there that show about 50% of children will have a fever associated with the SARS coronavirus 2 infection. About a third, a little bit more than a third of the children, 38% in one study, will have a cough. Rhinitis, runny nose, common symptom of the common cold, is present, and it's really hard to determine that in the studies because what you call a runny nose, other people won't. But rhinitis, the runny nose, is a common symptom, as is fatigue, which is something we see in children as well as we see in adults. The one thing children have that's different than adults is we see much more diarrhea present in children than we see in adults. And that really distinguishes this COVID-19 in kids versus COVID-19 in adults. Lastly, we know that very young children, infants, get infected, and they can have actually turn blue, and they can have difficulty feeding, although there are case reports of infants that have been infected that are completely asymptomatic and have no symptom at all. One of the things we know about children from all the studies we've been able to accumulate is that children are more likely to be asymptomatic than adults are. Now, that's a problem because how do we know you have coronavirus? I mean, there's rhinovirus that'll have the same symptoms. You can have parainfluenza infections that have the same symptoms. Influenza can have the same symptoms. Adenovirus can have the same symptoms. There's a host of viruses that can have exactly the same symptoms. And so sitting down there and saying, I have a fever and I have a runny nose and I'm a little fatigued and I have a little bit of cough and I have coronavirus probably doesn't hold weight. In my personal practice, I've seen a number of patients and their parents who were absolutely convinced they've had coronavirus. Now, I did an antibody test on those individuals, and I am surprised at the number of people who thought they had coronavirus do not have any immunity based on the currently available test. And I'm kind of surprised. So the point of that is that if we want to know all the symptoms in children, we have to sit down there and swab their noses and see if they have the test that's positive for coronavirus, this COVID-19. And I can tell you, as someone who's taken care of children for a long time, I have children of my own, I have grandchildren, you're only going to do this on a child one time before you actually have to pin him down. I mean, let's be frank about this, okay? It's an unpleasant test. Sitting down there and doing it on children creates a whole lot of problems. And they're really not going to let you do it repetitively because they do have good memories. And it's a painful, uncomfortable test. So as a consequence, it's really hard to sit down and say, do we know the full breadth, how many symptoms do we have from this side where it can be mild to none, to this side where it can be significant and require hospitalization. That's going to be difficult to come by because we're not sitting down there and swabbing a lot of individuals. The one thing we do know is that significant illness, critical care admissions, and death is extraordinarily rare in children. And there's documents and data available from a variety of countries around the world to substantiate that point.